So 27th question is, a 52-year-old female complains of increasing pain in the right shoulder. She is also finding it increasingly difficult to do overhead abduction of the affected joint. She had been diagnosed as a diabetic 20 years back and is on the treatment since then. What is the most likely cause of her clinical condition? A is rotator cuff tear, second is frozen shoulder, third is bacterial arthritis, and fourth is the osteoarthritis. So the answer will be frozen shoulder. So frozen shoulder will be the correct answer, which is also known as adhesive capsulitis. So why is this the correct answer? Because the first thing is that it is strongly associated with the diabetes. So it is associated with diabetes, also hypothyroidism, and heart disease. So this is the first clue, that she is having diabetes. Second clue is that there is progressive pain. There is increasing pain and increasing difficulty to do overhead abduction of the affected joint. So there is progressive pain plus progressive stiffness. Third is age and sex. Generally, this 52-year-old age, sex female, and she is having diabetic. This is the textbook profile of adhesive capsulitis. So therefore the answer will be the frozen shoulder. Now coming to other options, that why is it not rotator cuff tear? The answer would have been rotator cuff tear if there was history of trauma. There was sudden onset weakness. There was history of painful arc, about 60 to 120 degree. So if this would have been history, the answer would have been rotator cuff tear. So there are certain differences that we should know between the frozen shoulder and rotator cuff tear, because the DD of the frozen shoulder is rotator cuff tear. So in frozen shoulder, the active range of movement, active ROM, is decreased, which is also decreased in rotator cuff tear. But the passive ROM is decreased in frozen shoulder, but it is usually preserved in the rotator cuff tear. Third is association with diabetes. So frozen shoulder is associated strongly with diabetes, while rotator cuff tear is weakly. Then stiffness. Stiffness is marked in frozen shoulder. It is not prominent in rotator cuff tear. Then weakness is mild in frozen shoulder, while it is prominent in case of rotator cuff tear. Generally, the onset is gradual. In case of frozen shoulder, it is often after injury or degeneration. So that's why the correct option will be frozen shoulder, not the rotator cuff tear. Now coming to the third option, the bacterial arthritis. So bacterial arthritis, if it would have been the option, there would have been history of fever, hot swollen joint, and not the chronic progressive picture, rather acute severe pain. So bacterial arthritis is wrong. Then coming to last option, osteoarthritis, it would have been present. Then it would have given the history of crepitations, mechanical pain, and osteoarthritis of shoulder is not very common. Shoulder osteoarthritis is not that common. So the answer will be the frozen shoulder or adhesive capsulitis.